What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central stove processor? Guys, today we're going back to basics and we're talking scissors and decontamination. Scissors, guys, another important part of surgery. You will find scissors in just about every instrument set. I actually can't think of any surgery that can be done without scissors, actually. But that's not for this topic, right? This is about the handling and care of scissors and decontamination. As you can see, guys, it comes in every shape and style. One thing to automatically note about scissors is that they are considered sharps. Guys, it is very, 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 very important that you practice caution when handling scissors. When it's in a basket, guys, all right, OSHA gives us guidelines stating that you should not be reaching into soiled baskets if the sharps are not visible within the container. So whether it's in a basket or not, if you can't see those scissors, be real careful reaching in those baskets, guys. All right. So protect yourselves at all time. Look out for the scissors because, again, you have scissors that have blunt tips like so, but you have scissors that have very sharp tips like so. All right, this will easily puncture a utility glove, get caught under your nail, and hurt you pretty badly. So guys, please be very, very careful when handling and dealing with scissors. As such, when we clean them, we should be practicing care. One thing to note is scissors are meant to be sharp, right? They're meant to cut. So one thing you don't want to do is you do not want to use a wire brush to clean the blades of a scissor. That is a sure way to dull out a blade, okay? So again, we're going to talk with the manual cleaning and the manual preparation of scissors. So we'll talk more about the handles later on. But again, scissors come in all shapes and sizes. But the anatomy of the scissor is pretty straightforward. You have the jaw of the scissor, you have the box lock or the union, the shaft, and you have the rings. All right. Scissors have a cutting action. Some scissors cut by a crushing action, others by slicing, and we'll speak of that soon. One thing you want to inspect in decontamination is you want to look out for that screw, right? There is a screw that holds these scissors together, right? The majority of scissors, I think all scissors actually, and all scissors of some sort have a screw. You want to make sure that screw isn't backing up, and you want to inspect that screw for bioburden. All right. So when we're cleaning our scissors, guys, I'm going to use a basic scissor here. You want to make sure that your scissors in the wide open position. If they pre-cleaned that scissor at point of use very good, it should look something like this scissor, actually. Pretty clean, but with a couple little spots on there maybe, you know. So you want to rinse off that pre-treatment. You want to get off whatever visible soil that there's on there. And if you're manually cleaning your scissors, okay, you want to prepare your chemical bath or your detergent, whatever you're going to use. Soak for the allotted time stated by either the manufacturer of the instrument or the detergent. Okay, once that soak time has expired, again, you're following IFUs, guys. The IFUs may sound different from what I'm explaining here. Please, 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 please follow your IFUs. But this is just general cleaning. After you're soaking, you want to use a soft bristle brush to remove the visible soil and invisible soils off the blade, the box locks, the shaft, and the rings. One thing to note with scissors is please look out for any adhesive. Sometimes during surgery, there can be some adhesive on the rings and on the blades of specific scissors. some of the blunt scissors that they use to cut fabric, like the bandage scissor, or some of the Mayo scissors they use to cut cloth and bandage, and you'll often see adhesive on the blade. So please be aware of that. Your detergent will not break that down. You would need either an adhesive remover or a good brushing to remove that. Another word of caution in decontamination: if you are using a sponge or a towel to clean your blade or your instruments, okay, it is wise to go ahead and do the shaft and the rings, but the blades I would not recommend doing that with, because you can easily yank and pull to clean and not realize how sharp that scissor is, and it'll cut through the fabric and through your gloves and you won't even know it, guys. So it's probably best to stick with a brush. It doesn't have to be this small, it can be a little bit bigger to cover a little bit more surface. For your instruments that are micro instruments, okay, so this is from like a little eye set. This is a very small scissor. Again, this unhinges, is a Castro style, it opens up. Again, probably a smaller brush than this to get in those areas that are really, really small. Again, looking for that screw to back out. Another type is the ENT type scissors. Okay, these scissors actually can come apart in decontamination, so please refer to the IFUs. Okay, so there is a little hinge on there. Okay, anything that can come apart should come apart. It actually pops out. Let me see if I can do this for you guys here. So this piece pops out and this scissor actually props open. The other part of this scissor that comes apart is actually the handle. And this is a brand new instrument, so there you go. The handle also comes off. So you want to clean all that separately, guys. Be very careful with this because it's very delicate. You want to brush in that track in there with this type of scissor. Is get in that track. Brush really good because there'll be some bioburden hiding up in there, or if this is using an ear set, there'll be some wax or something in there. Brush those instruments really good and make sure that when you send it through, again, this is the hand wash process, send it through with all the components, guys. So I have to talk about manual preparation as well. Manual preparation is the step prior to any mechanical cleaning, guys, and I am going to acknowledge this because I've been speaking a lot about it and going back and forth with this which one. So I have to acknowledge it, even though it's a step that I have not practiced and I'm not very familiar with, but I do know of the manual preparation step because it does make pretty much common sense, really. It is a common sense step. That instrumentation that goes into any kind of mechanical cleaning or automatic cleaning, if there's not a lot of bioburden or any baked on or excessive soil on the instruments, then the need to brush every single instrument is not necessary. It would require a good rinse, maybe a soak in detergent if required by the IFU, and then placed into a basket to go into either the ultrasonic if that's validated, or the washer disinfector. One thing I did want to point out here, if I have some time here for you guys, is that when you're loading your basket with your sharps, this is my opinion, guys, this is only my opinion, I am not a fan of placing scissors in the open position standing straight up in a basket, guys. I think that's a bad practice. It's a good way to get somebody hurt. Sharps should lay in the open position and flat in the bottom of the basket to avoid any injuries. Can you imagine having this sharp instrument pointing straight up? Somebody isn't paying attention and they jam their fingers. So sharps should lay in the wide open position, laying flat on the bottom of the tray, and your blunt instruments should be standing up in the tray. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself, and until next time, peace.